Hello everybody, coming to you from the Afrimerican Culture Initiative, a Boston-based nonprofit 501c3 organization with the mission to build cultural bridges in the African diaspora through education, technology, and travel. So in essence, we are your online source for African diaspora multicultural education here in the United States. Before we get started, I just want to say everybody, we're here to talk about COVID-19, so I want everybody to be safe out there, practice social distancing. It is working. Let's not hold up, let's not let up now. During this Easter season, let's spend our time, sharing and caring about our loved ones. Let's not close ourselves off. I want to send a special thanks to the heroes out there, the first responders and essential workers, medical staff who are out there on the front lines fighting this battle for us. We see you, we love you, we appreciate you. We're here for you, and we're gonna be doing our bit at the Afrimerican Culture Initiative to support you in this tough time. We want to send our prayers out to those who are sick or affected by the disease. We pray for you. We pray for your quick and speedy recovery. I can't imagine. I haven't been touched as of yet, but I'm very much sure I'll be in the same boat soon. So, just prayers. Everybody, stay safe, right? And then finally, we want to extend our deep and heartfelt condolences to those who have been touched and whose lives have been lost due to the COVID-19 pandemic. Finally, on a happy note, it's Easter. It's a time of renewal, time of being born again, and we are looking in a positive. I'm trying to give a positive message. Yes, it's going to be tough. Yes, we're going to have to stick it out. But hey, we believe that He does not give you more than you can handle. We are an African cultural diaspora educational organization. What we try to do, we try to practice kind of what we preach. So we talk about oral tradition being one of the primary ways that people of African descent have shared stories, folklore, traditions, norms since the beginning of time. So our people, we understand that these video formats, online, access to some of this information is a crucial way of helping the African diaspora cope, because there are cultural ways even of dealing with loss and death, and there are African ways of doing that. For instance, we do not believe, well, in the Yoruba culture, I'm sure there are a lot of different cultures, but I can only speak of the Yoruba culture. And Yoruba culture, the parents do not bury the dead because of the psychological, and it's a psychological protection, cultural norm that we do to help, because nobody should bury their own children. So other family members will take the thing, and you won't allow the mother to see the body because we believe that is just too tragic. Also people that live the full lives, we celebrate their lives. We do not, mourn. Now we're mourning, but person lives a full life. That's what we're asking for. So even if it's taken a little bit soon, we thank God that some of our elderly that are being attacked, we respect our elders in African culture. And so this because they are vessels of knowledge, and these vessels of knowledge are being taken away from us. So please call your grandma, send her your love, ask her questions, because you know what, you got to learn everything. There's so much I learned even about my work here at Afrimerican Culture Initiative about race, dealing with my great-grandfather who was a slave, who was a grandson of a slave. So respect your elders is another concept. So anyway, let's get into why we're here. Okay. We're here to talk about the multicultural COVID-19 rapid response that we are doing. This is our organization's effort to combat this disease. So basically, let me read what we have here. This is our promo that we're having out there. It's going to be on our social media. So this is, let me read that for you. Our goal is to be a reliable source of accurate information, emergency resources, and support for multicultural low-income communities in the greater Boston area. Okay? We will be working with, coordinating, and supporting many grassroots organizations in multicultural low-income communities via our online platform. So, very important, sign up, because everything we're doing is trying to use the internet as much as we can to get the word out there. Sometimes if you sign up and you get an email, you know what your contribution can be? Just to forward the email, right, to all the people you know, right? You may not need something, somebody else might. Okay? We aim to simultaneously, let's read. Oops. Okay. We aim to simultaneously increase the overall impact of our collective multicultural community COVID-19 rapid response and reduce misinformation, waste, and redundancy in creative ways. Okay? Multicultural low-income communities are being disproportionately affected by COVID-19. Being disproportionately affected. So we need you to please save lives, help us get information out, deal with the issues that are plaguing the community right now. Donate. We need your support. All right. So I've been in the community, well, not necessarily in the virtual African diaspora community, doing a lot of Zoom meetings and stuff, meeting with community leaders, talking on the phone, and it seems as if there's some, the issues that are coming up where, of course it's somehow anecdotal, but we're identifying some general broad areas of interest and focus that are of urgent need. Now, when I say urgent need, I mean like it's getting really bad, and we have the peak. The peak is coming up right now, and then, like I said, this might be a prolonged issue that we're dealing with. So we better know how we're going to moving forward. So the first one is education, right? And that's kind of what we're doing now, right? Videos, online resources, right? To educate people, give them real good information, send them to the right websites. We're going to have a lot of Zoom meetings and try to do some group some group meetings so we can talk about some of the issues. I know there's a lot of interest to get the conversation started around issues of race and what that means. So we'll be having a lot of interesting online chats, and we hope that you can be involved. Like I said, sign up so you'll be notified when we get those started. Resources and services. This might be one of the more crucial things. What is already out there now? There are groups out there that are doing work. We don't know them. They don't maybe have some of the resources. Maybe there's a pocket somewhere. For instance, in the Ugandan community in Waltham, they are giving out food. People are donating food. They're keeping it as a person that had a business place and all these. There are so many different people out there going to be doing everything, and that's why it's very important that our work continues here, because our work should be to make sure there's not a lot of redundancy, or if there is redundancy, let's join forces, or basically some management on a local level, on a grassroots level, of what's going on and resources and what's available, so that people can find a way to navigate through all this pandemic, plus the fact that nobody's got any money now, right? So let's go through some of the resources real quick. All right. This is Oja Express, right? You can go to I got this off of their their Instagram page. And the Oja Express, basically you can buy African cultural food items. So basically these are some resources that, you know, are particular to the African diaspora community. Plantain, puff puff, chin chin, and suya. This is a Nigerian. I'm Nigerian. These things are these are some of the rare delicacies that you can find. Especially this suya, very dangerous stuff there. So anyway, yeah. So these are some of the resources, especially in this era of social distancing. This might be how we may have to move forward, right? Let's support these companies, these companies during this time, right? All right. This is another a very important resource that we'll be having out either through our videos or online posted, of course. And this is what they call the Boston Somali Community COVID-19 Response Hotline. A response from the Somali community. These are all resilient efforts, right, by the community. These communities are fighting back. They just need support, right? It's not like you don't have people from all necks. So these are my Islamic brothers and sisters who, you know, God willing, they're going to make a big splash and help out people. What are they doing? They have a hotline number, 617-683-6506. Right? They have this Boston Somali Community conference call, right? And you call in. They have, I think they hold it every day from like 8 to about 10. And you call in. So that's the number right there, 857-444-0744. And then they have a pin there. You know, it's sponsored by Caring Community, Boston Islamic Center, Refugee and Immigrant Assistance Center. And what do they talk about? They talk about unemployment. Right? All of us are dealing with that. DTA, SNAP, employment concerns, rental assistance, housing issues, counseling, and more resources. So these people are in the community already. They have access to some of these resources. We're getting the information out to you so you can do the best you can with them. You know, what we're finding, some communities, they just need this. They just need you to find them. That's all they need. So we are going to try to facilitate those processes, right? All right. This is more on the more of a pop culture sort of thing. We have one of our friends of Africa here. He's looks like Lakshman Swami. Well, maybe Pakistani or Indian descent. He's then in the battle, Boston Medical Center, right? And this is part of the misinformation that's out there that we're trying to combat, right? We want everybody to understand that, look, guys, I mean, there are young patients out there. Remember when they were telling us that, oh, it might not be, might just be old folks, might just be people who are, you know, needing to, you know, have cancer, or you know, they have some other disease for themselves. So these are the things that we thought that was the issue, but now we're finding out that, guess what, there are young people out there, right, that are getting the disease, that are getting sick, right? So these are some of the misinformation we'll be having. Like I said, forums, Facebook. We have Britt Johnson, you know, Boss Lady News. She's on the Boston News Network here in the community. She'll be spearheading a lot of our efforts. So hey, shout out to Britt. You know, I appreciate all the work you appreciate all your work you do. Excuse me. We also have real educational resources, right? So this is some coronavirus financial information, right? We're all having issues, and one of the main issues is like rent. Like, what do we do, right? You know, we're telling people, hey guys, just, you know, get in touch with your landlord, let him know, right? And what they're doing to help you, it seems as if, look at the second one, right? So landlords can extend repayment deadlines for commercial loans for up to 90 days in lieu of evicting tenants due to non-payment. The White House is considering taking additional steps to help renters. So if you rent, what that means that because they don't want to evict you, please don't evict these people, right? What we're going to do as banks, they're going to give them 90 days they're going to give them 90 days to pay their loan. So if they have 90 days to pay the loan, they shouldn't come at you, the renter, and 90 days. And like I said, the White House is considering taking additional steps to help the renters. Okay? So that's some more information. What's this? Okay, yes. Dr. Fauci, thank you so much. I, in fact, got a lot of inspiration to do this work because of, I said, this is how you want to talk to the people, right? So thank you, Dr. Fauci. We appreciate all your hard work. Okay, so Dr. Fauci is basically saying, on Anderson Cooper, that America getting back to normal might not happen until there is a vaccine. So what does this mean? They're saying the vaccine is going to be a year to a year and a half away. What does that mean? What does that mean for our lives? Does that mean that I will have to think about if I'm comfortable going to a Celtics game? Right? Is that going to be safe? Right? Until I have a vaccine? I think so. So what does that mean until then? We don't open up fully? These are some of the discussions we must have. We've got to get together as a community and get closer. So like I said, a lot of online forums. We'll be trying to do a lot of these things. Let's have fun, you know. We're all sitting at home, trying to social distance. So it's important that we connect, you know, call your grandma, call people, you know. There's going to be a lot of therapeutic, I think, exploration that we're going to really find during this tough time, right? Okay, this is some of the bad news. This is some of the information that we're dealing with, okay? Right? According to CNN, coronavirus is hitting African American communities harder. This is how bad it is, right? We're talking about 30% in Chicago, right? Love Chicago, huh? Don't think I know about some Harold's chicken, right? Right. Right, with the mild sauce. All right, Chicago. Okay, so, yeah, so we have 30% of the population in Chicago is black, right? African American, right? The deaths are 72%. Milwaukee, same story. 26 population, 71, even worse than Milwaukee. Right? We have here percent of the population, 15 in Illinois as a total, and you can imagine this is very skewed by Chicago because we just saw those statistics. So 42% with only 15% of the population, nearly 3 times the amount of people, right? Louisiana, same story, 33 to 70. Michigan, same story, 14 to 41. I mean, so we're not going to go right now, but there's a lot of conversation, especially in the African American community, that you see. This is why when we speak of things like reparations and things like that, people go, "Oh, you're talking." No, this is the face of it. Now we're not going to get into it right now. Right now, we're trying to save lives, but this is not about any particular, you know, political ploy or whatever. This is about, these are real. This is what's happening. A person that is of color, right, that is 40 years old, or I don't know the actual stats of that. It will be interesting to find out. But a person that's like 40 years old is almost equivalent to somebody, you know, that's Caucasian, that is 70 or 65. That's why those are the people that are dying. That's a very chilling statement. So anyway, these are some of the things that we will be discussing, and we'll have a lot of time to discuss it, right? What else? Okay, now this is the last one I want to show you of resources that will be kind of given, you know, just some reality checks. This right here is a sad reality check. This is from 3 days ago, right? That's April 7th. Today is April 10th, right? This is now like 6,000 to 7,000 more deaths since in 3 days. Okay, guys, this is not funny. It's not a joke. I don't know how best to describe it, but we have got to step up, because these communities, people they don't have the resources, they don't have the savings, they don't have much of nothing. And this and we need to work together at this point in time to ensure that we are doing our part to make things easier, you know. And it's going to be a long slog, right? All right, back to what we're doing. All right, so finally, okay, so we're back here. Now the last section, really, I just wanted to talk about it. I left, you know, because it's really, you know, we can't go there now, right? It's very expensive to find accommodation, especially we're just you know, a small organization. So if we're thinking about it, we've thought about partnering with hotels, you know, providing accommodation for people now. But I feel like I want to address a little bit about what we're finding. We're finding like immigrants that maybe just got here not too long ago, and they're here and now they've got the coronavirus, right? They didn't really have a place to stay, but they were staying with somebody. They get sick, they get discharged from the hospital, they're good to go. But the people that are not like, look, please, you know, we just don't feel safe. We have kids, we have, you know, an old grandma, somebody living in the house or somebody, you know, and we don't want to we don't want to have you back. That person is not homeless, right? I can think of many situations where a single parent, maybe he's working, you know, in a grocery store, and now all of a sudden they don't have, you know, they get fired or they get sick, and then they have to go in, and after they get out, right, their kid, where's their kid gonna stay? Who are the kids gonna stay with? Well, they need to quarantine that kid and somewhere special because it was in contact with the mom, so we have to test the child. We're waiting for the results. And where do you have to stay? These are the kind of things that that people are gonna need hotel rooms for. Hotel rooms are very expensive, very costly solution, but it's the only thing we can think of that's empty quick. In China right now, that's what they did. They would find people, and yes, it was draconian. I'm not advocating for the draconian measures, but I do believe that some of the technical ideas behind it need to be looked at, because this is about science, not about, you know, any kind of division, any other division. So they would put people in hotels, right? They would just take people and put, like, you're part of the Chinese government, you're not paying, we don't have to pay nothing. We're going to put you in this hotel because we need a room to quarantine them in, right? And then they can have food and every food service and everything. You know, everything is, the system is already there. Yes, it's more tush, but guess what? This is not about money making. It's about saving lives. So there's accommodations like that. Then there's something that I want to actually bring, and I think this is a pretty big one. And I really want a lot of people to think about this idea. And please, I want to spearhead this one myself. The medical staff. Imagine working 16 hours, 24-hour shift with COVID patient after COVID patient after COVID patient, right? Now, you may not even want to go home because you don't want to infect your family or whatever, right? But you actually just want to go and sleep and rest, and you can't. How about we get that doctor an Uber, take him to a hotel, let him have a place where he can just cool down. Not everybody will be able to take advantage, but some will. And let them, you know, especially that work in the community, let them go home, let them go sit in the shower. I love to do this. I'll be in the shower for about an hour, like just letting the hot water just soothe and cool my brain, right? And let's give them that, a night just to relax and then get a good night's sleep, and then get an Uber for them back in the morning. Their clothes, we'll try to get their clothes washed there, and just maybe get them a little bit of meal or something. But that's what we need to do to take care of our first responders. These are the ideas that we want to look at. I'm going to do my best to try to sort out a group of people, a team of people willing to take this on, willing to take on a challenge. It's very costly, but I think it's very, very important. All right, now who's eligible? I know that's the next question, right? So our COVID-19 Rapid Response Assistant eligibility, right? The first thing you need to be 18 years old and hospital discharged COVID-19 patient, right? So we want to direct our resources, limited resources, to the COVID patients in these multicultural communities, right? Low-income communities, right? That's the second one, right? Must be a member of the multicultural low-income communities. We want to make sure these guys, they're not going to have a lot of options. It's going to be home. In fact, word is, and this is some of the grassroots information that we want to provide, is that if they don't have a place to stay, the hospitals are keeping them and looking for alternatives to discharge them to. So maybe if you put, we can put some money together, you can help somebody have a place to stay for a week or two, right? We need partners, we need hotels to take on the challenge. You can't charge for, this is an emergency, all right? Anyway, I digress, right? The next one is, must be an essential worker in hospitals serving multicultural low-income communities. So essential workers, medical staff, etc., bus drivers, people that are on the front lines making this, risking their lives and the lives of their families. We want to be able to help them. I know we can't help everybody, but we're going to try and help some people that fall into some of these categories, right? And then last but not least, our first responders who are responding in these guys, we're so proud of you and your continued battle. Every time there's a crisis in this country, you guys run in first, ask questions later, and you just start helping people. So we want to thank you for your service. All right. Now, what we're doing, like I said, is we're just trying. At this point, right? At the point of your meeting is, we're trying to set a lot of things up. So we need you to sign up. We cannot do this alone. You don't have to do anything magical. Some things you can just do is that if you get an email, if you sign up on our email list and you get an email, just forwarding that email to somebody that may need it is maybe all we need, okay, to turn the tide. But just do something, right? If you need assistance, please set it up. If we don't have it, we'll put you on a list. We'll try to help out. Like I said, we're just getting started, but we're very confident with our network and some resources that we're trying to apply for, that we'll be able to at least get something started, right? Help some people out. The rest is up to us. Then volunteering. We're going to need help with a lot of different things. Please sign up, and then as we're moving along, we can definitely know how we're going to get these things done. Donations. Very, very critical. If it's just $5, please. I know it's tough, but if you got it, please give what you can. These people, there are people that simply, they just don't have it. It's not, there's nothing to say. They just don't have it. They need your help. Then of course there's sponsorship and partnership. There are organizations out there. We need you on board. I'm gonna, like I said, try to get a bird's eye view of what's going on in the community and see how best to manage and advise and somehow skew to find a way to make our efforts, our collective efforts, more effective and manage waste and and redundancy and things like that, right? So please go to our website, afrimerican1.org at /COVID-19, right? Okay. And now you can sign up there. There's a form, online form. Please sign up, and let's do this together. Okay. So, all right. I know I've been talking for a while, but it's time to do it. It's time to come together. I'm excited. It's unfortunate that we're going to come together around these times, but we're committed at the Afrimerican Culture Initiative, and we have some great board members and supporters and community members that are devoted and committed and passionate about our communities, and we're going to fight this thing. We're going to fight this thing together. Okay. So now just to give you some of our contact details, because a lot of what we're doing requires you to know that we have many ways of accessing us. Okay. So the first is we have a GoFundMe page, right? charity.gofundme.com/multicultural COVID-19. All right, that's GoFundMe. Go to GoFundMe, and we have a charity page. It's called charity.gofundme.com/multicultural COVID-19. And like I said, if you don't have it, share again. This is a fight. Every time you feel bad about something, every time you do, there's an issue, or I was watching news the other day, and one of the anchors, I think it's Poppy, I forgot her last name, on CNN, and she just started crying because she was talking about a little girl that had passed, right? So every time you feel something negative, this is a bullet to fire back. Just one more bullet that all of us have to grab our own collective bullets and fire back at it. And if it's just to share, then do it. If it means I'm going to do it every day, do it every day. Because this coronavirus is coming for us every day. Right? Okay? We have our email, covid19@afrimerican1.org. A special email dedicated to this line. Send questions, ask things. I think it's important that I'll do my best to answer it, or I'll work on ways to getting them answered. But yeah, we also have a hotline. Now this hotline is really for emergency. Right now we want to just keep it for the emergency. The patients. So please, but if you do have a question you want to ask, I'm not saying don't call it, but just be discretionary. If you can find the information online through our thing, do that. This is for really our emergency hotline for people who actually need urgent help, and we can try and get them the resources that they need, right? Let them know the programs that are out there. And finally, donate. Go to the organization. Go to the website. You can donate there to learn about what we do. We give free online classes, support. And let us be able to educate our children and everybody about African diaspora multicultural education. Okay. Finally, these are all us. We're on Facebook, Twitter, Instagram. Please subscribe at the YouTube, because I'm trying to get this YouTube followers up. So please subscribe. This fight. We need everybody to do whatever you can. Just get involved. Just do something. Just don't sit down. That's all we gotta do is sit down in our house. But you get what I'm saying, okay? So we need your engagement. We need you to get involved. We need your donations, right? Thank you for supporting us and doing all that. Thank you for doing all that you can do for our organizations, for our people, for the people in my community. We are being disproportionately affecting us, but we're still standing, and we're still resilient, and we're still positive. And then this Easter weekend, I want to wish everybody God's blessings and abundance, right? God's protection and His mercy, right? And I'll take it to church, but I'm not I'm a big spiritual guy, and I just believe that we have to, if we don't come together now, then when will we come together? If we don't push collectively now, when will we push together? If we don't reorganize ourselves and get to know one another now, then when will we know each other? Let's build these cultural bridges together. Let's make it happen. Let's kick COVID-19's butt. Thank you.